Today, I'll be talking about the lungs. Physiology of the lungs. The lungs are the fourth biggest organ in our body, and also being one of the most vital organs that help oxygen from our airways to enter our red blood cells. Then the red blood cells carry oxygen and other things around our body for usage. The lungs also are key to removing CO2 when breathing out. Through this, if one of our lungs are impaired or non-functioning, it places more stress on the other lung, causing possible long-term issues. The diagram on this slide demonstrates the physiology of the lungs. Anatomy of the lungs. The lungs are made up of various areas and parts such as the trachea, a large membranous tube reinforced by rings of cartilage extending from the larynx to the bronchial tubes and conveying air to and from lungs through the windpipe. Superior lobe of left lung, delivering oxygen into the bloodstream and removing carbon dioxide. The right main primary bronchus. The right primary bronchus is responsible for making the air enter the right lung. The lobar secondary bronchus, to deliver air to the two lobes of the left lung, the superior and inferior lobe. Segmental tertiary bronchus. These supply air to the bronchial pulmonary segments. There are 10 of these. Inferior lobe, left lung. As referred to them above, they deliver oxygen into the bloodstream, removing carbon dioxide. The transplant of lungs. The transplant of lungs is a long procedure that is carried out by a specialist surgeon. And what occurs is when a person is on a waiting list, told they are next to receive a transplant, they will make their way to the hospital where they'll be prepped and ready for theatre. The transplantation of the lungs is fast due to the lung has to be chilled and can only be allowed out of the body for a certain amount of time. Once the patient's impaired lung is removed, you can see here on the diagram the way they reattach the lung is through connecting to the bronchial and pulmonary arteries, which connects to the heart, and finally reconnecting to the left arterial valve on the heart. They check the breathing rate straight after surgery, and further they move on to rehabilitation through using suppressive drugs to calm antibodies that want to attack the new lung. Cost and statistics. Encouragingly, the number of families who consent to organ donations has risen over the last few years to 15%. Fortunately, transplantation is fully funded by the public hospital system in Australia, so eligible Medicare patients don't have to pay for transplants procedures themselves. Nevertheless, patients must still have to pay for their drugs and antibiotic costs. The transplants in Australia's price bracket cost from about $35,000 to $100,000. Lung cancer. Lung cancer starts when the abdominal growth cells grow and multiply in an uncontrolled way. Lung cancer is the leading cause of cancer and death in Australia, and the fifth most common cancer diagnosed in Australia. It is responsible for almost 1 in 5 cancer deaths in Australia. Symptoms and effects. Some symptoms or various symptoms include shortness of breath, wheezing, weakness and fatigue, loss of appetite and weight loss, coughing and phlegm or blood, nausea, vomiting or high blood pressure. If these start to occur on a regular basis, it is best you visit your nearest GP or cancer clinic. Effects. If left untreated for too long, effects such as shortened life expectancy, very slow and painful death, becoming extremely ill quickly, bronchitis or pneumonia. If you make any of these stages, you'll either be put into an intensive chemotherapy. Otherwise, if left untreated, this will result in either death due to lung cancer or other diseases such as stroke. Main causes of lung cancer are smoking, lead or gas inhalation on a regular basis, genetics or inherited, asbestos. If this is constantly continued later in your life, you'll earn a higher chance of lung cancer. Treatment. The main treatment plans include chemotherapy, a treatment of a disease using chemical substances, especially the treatment of cancer by cytotoxic and other drugs. Radiation therapy uses high-powered energy beams from sources such as an X-ray and protons to kill cancer cells. During radiation, you lie on a table while a machine moves around you, directing radiation to precise points of your body. Radiosurgery is an intense radiation treatment that aims many beams of radiation to many angles of the cancer. Stereotactic body radiotherapy treatment is typically completed in one or a few treatments. Thank you for listening.